Today, we're going to be talking about teaching and learning principles. This is very important. If you think about a hierarchy of nursing skills in which registered nurses engage, teaching is at the top of that hierarchy. And that is why you get so many teaching learning questions on the NCLEX. The National Council of State Boards of Nursing wants to make sure that you're going to practice at the full scope of your nursing license. And so you need to be prepared for a lot of teaching learning questions. Today, we're going to be talking about teaching learning principles. So stay tuned and we'll go through questions related to that. Hello, Klimek Review family. It's Dr. Sharon with Klimek Reviews. Today, we're going to be going through the Blue Book, continue going through the Blue Book. The Blue Book is called, the name of the Blue Book is the Blue Book, y'all. It doesn't have another name. And interestingly, if you care about why it got that name, Mark Klimek started doing NCLEX reviews 40 years ago. And when he started, I was one of his first students in taking his NCLEX review back in 1992, which was 30 years ago. So I was in the early phases of him doing NCLEX reviews. Anyway, he started out very informally. We used flashcards, he used overheads and so forth. And over time, he developed his NCLEX review to where it got down to 3 days. And you can do it online, okay? But it was in person 3 days, and he handed out 2 books. One had a yellow cover and one had a blue cover. And he called it the yellow book and the blue book. And the yellow book was the content that you go through in the review itself. As he's teaching you, you go through the yellow book, and the blue book, you would be given that as a list of facts that you had to know. And it is important to know facts, not just principles. And so this is why he still calls it the Blue Book, because it started out with a blue cover. That was how it was handed out, and he just continues to call it that. So the Klimek Review Blue Book, written by Mark Klimek, is essentially a list of facts that you have to know. If you graduated more than 2 months ago, you probably need to know the facts, review the facts in the Blue Book. Anyway, we're going to be doing pages 16 and 17. I'm not going to spend a lot of time talking about what's in the Blue Book. I'm going to teach you these principles by going through questions, but it is covering the content on pages 16 and 17. And so we're going to talk about how do you know a patient is ready to learn? What are some examples of when they're ready? What is intellectual readiness? That's a question that he asks here. And then he says, should you ever ask if the patient is ready to learn? I don't have that in a question, but is it appropriate for you to ask the patient if they're ready to learn? And the answer to that is yes. It is always appropriate to ask the patient if they're ready to learn. Listen, show your patients respect. They're adults. They have self-determination. We value autonomy here in the United States. So ask them if they're ready to learn. If they're not ready, then you can explore why they may not be. And then there's learning styles. And I'm not going to talk really about that, honestly, but learning styles include auditory, listening. How do you like to learn? Do you like to listen? And then visual? Do you like to see what's going on? And then the last one is kinesthetic, which is hands-on physical action, doing the action that you need to do. So different people have different styles, and then different types of teaching go better with different things that you're teaching. So if we're talking about attitudes, we may do auditory, right? We may just talk with people about it. What's going on? How are you feeling? If we're teaching a skill, we may start out with visual. We may show them visually what it looks like and then move on to kinesthetic, for example. So you do need to know those vocabulary words. And then we're going to talk a little bit about what do we do if the patient doesn't want to learn. Okay, so that's the content here in the Blue Book. So let's go ahead and get started with these questions. Question number 1, a nurse is preparing to teach a newly diagnosed diabetic client about insulin administration. The client appears anxious and tearful. What is the most appropriate initial action for the nurse? I'm highlighting the key words that I focus on when I go through these questions. Okay, newly diagnosed, insulin administration. The patient is anxious and tearful. So I think they're anxious and tearful. May not be a great time to teach, but let's see. So it says, what are you going to do first? What's the initial action? So what I may see here is multiple things that I would do. And I say, well, I would do several of these things, but what do I want to do first? Proceed with the teaching session as planned. So that one I'm going to cross off right away. They're anxious and tearful. I'm not going to do that. Provide the client with written materials and ask them to read them later. I might do that. That's maybe that may be a good way to start out teaching if they're newly diagnosed diabetic. Assess the client's emotional state and ready to learn before continuing. I would absolutely do that. Call the healthcare provider to discuss the client's anxiety. I'm not sure that I would do that. I would have to have a lot more data before I would do D, because as the nurse, I can provide 5-dimensional care. I can provide emotional, physical, spiritual, intellectual, and social care. I can provide 5-dimensional care. So I don't have to call the healthcare provider about everything. So I would do B and C. So which one would I do first? Would I first provide them with written materials and then ask them about their emotional state and readiness to learn? Or would I first ask them about their emotional state and readiness to learn and then provide them with written materials? Well, I would want to assess first. And a lot of people say to me, you always assess first. You always assess first when you don't have enough data to make a decision. And here I don't have enough data to make a decision because I don't know why they're anxious and tearful. Maybe something totally unrelated to their diabetes that needs to be addressed before we can teach, or it may be anxiousness and tearfulness about their diabetes. I don't know. I don't have enough data to make a decision. So I need to find out what's going on. Question 2, a client recovering from abdominal surgery is scheduled for discharge teaching regarding wound care and medication management. Okay, so abdominal surgery, they're scheduled for discharge teaching, wound care, and medication management. The nurse notices the client grimacing and reporting pain rated at 8 out of 10. What should the nurse do first? So this is physical readiness to learn. The last one was emotional readiness to learn. So they have to be emotionally ready. They have to be physically ready. And so they have pain at 8 out of 10. So the question is, are they physically ready? And I would have to say, I don't think they're physically ready to learn if their pain is an 8 out of 10. So let's see what the answers are. Administer the prescribed pain medication and delay the teaching session. Well, that seems like a good idea. Begin the teaching session to distract the client from the pain. You know, if their pain was a 2 out of 10, B might be a good option, but 8 out of 10, I'm not crazy about B. Ask a family member to stay and listen to the teaching instead of the client. Well, not instead of the client. I may want to ask them to stay there along with the client, but not instead of the client. Proceed with teaching, emphasizing the importance of pain management. No, that's not a good idea. So the best answer, or the first thing I should do, I guess, it's a first question. So the first thing I should do is administer the pain medication. Absolutely. Because they need to be physically ready to learn. 3, a nurse is about to educate a client on managing hypertension. The client seems confused and keeps asking repetitive questions. What is the nurse's best approach? So they need to be intellectually ready to learn. That means they're capable intellectually and ready to learn what you're getting ready to teach them. And that also includes, do they want to learn? Okay, so there's a component of wanting to learn as well that kind of goes into intellectually ready to learn, but they seem confused and keep asking repetitive questions. So I say, are they intellectually ready to learn? So they need to be emotionally ready, they need to be physically ready, and they need to be intellectually ready. A, continue with the teaching session as repetition will help the client understand. Well, let me reread the question. They seem confused and keep asking repetitive questions. So A, it doesn't address the confusion. So I'm not crazy about that. B, assess the client's understanding of basic concepts related to hypertension and adjust the teaching plan accordingly. That seems like a really good idea. C, provide detailed written instructions and ask the client to read them at home. That would be okay if we just wanted to reinforce the teaching, but this seems like they're confused and keep asking repetitive questions. So I'm not sure that just giving them written instructions is enough. Schedule another teaching session for a later time without assessing the current situation. Well, that's not good. I need to know why they're so confused and asking repetitive questions. So I need to find out, do they not understand the vocabulary that I'm using? Did they not even realize they had a hypertension diagnosis? Are they incapacitated in some way? Are they emotionally upset in some way? What's going on? So I really need to figure out what's going on. And so I need to assess what's going on. Remember, assess is a great option when you don't have enough information to know what's going on. And so assessment is great. Now, if you know what's going on, then you don't need to assess. You need to take action. But here we don't know what's going on, so I have to assess. Okay, 4, a nurse is teaching a client newly diagnosed with hypertension about lifestyle modifications. The client states, I don't need to learn this. What is the best nursing response. So how do we respond if a patient doesn't want to learn? A, what is the best nursing response? Okay, so we're looking at quotes here by the nurse. A, it's important to follow the doctor's orders. B, I'll give you some pamphlets to read instead. C, we need to complete this session to manage your condition properly. D, can you tell me why you feel this way? Whenever we're looking at a response to kind of an emotional statement, this is sort of an emotional intellectual statement. I don't need to learn this, right? We're not sure if it's an emotional or an intellectual statement. What is the best type of a response? And the best type of a response to an emotional, intellectual statement, a belief statement, I believe this to be true, or I think this might be true. Our best response is to encourage them to continue talking about it, right? We want to know why. We don't know why they said that. So I need to reply in such a way that encourages further communication with me. So for me to just disregard what they say and say, it's important to follow the doctor's orders, that's not a good statement. That's not a therapeutic statement, y'all. It's not therapeutic. I'll give you some pamphlets to read instead. Well, they just said I don't need to learn this. So why would I give them pamphlets? They're not going to read them. So B's out. C, we need to complete this session to manage your condition properly. That's like saying we need to complete this session so I can chart that we did it. That's no better. That's no better than saying that. Okay, no, that's bad. Can you tell me why you feel this way? So that's the most therapeutic response. The most therapeutic response is to encourage them to talk to me, and asking an open-ended question is a good idea. 5, a nurse is preparing to educate a client about postoperative care following knee surgery. The client states, I don't need to learn this. What is the best nursing response? So we have another statement saying, I don't need to learn this. So is there another way to respond? Well, let's see. A, this information is critical for your recovery. Well, that's probably true, but I don't know that that's the reason they don't think they need to learn this. B, let's talk about how you're feeling right now. Well, that's encouraging them to continue to talk. C, I'll come back later when you're more ready. That's okay. If someone's not ready, whether emotionally, intellectually, or physically, if they're not ready, it is okay to postpone the teaching. But that doesn't mean we just go, oh, okay, I'll just come back later, especially when they tell you, I don't need to learn this. Well, why don't you think you need to learn this? Please listen carefully. This is important. Well, that's sort of disrespectful. Like that's just ignoring what they just said, right? I don't want to ignore what they just said. So D ignores what they just said. A ignores what they just said. B and C, neither one of those ignore what they just said. Okay, so that's fine. But which one is better? Which one is the best one? And the best one is the one that encourages the patient to talk about why they feel this way or why they believe this to be the truth. So that's why I say it's an emotional, intellectual response. Do they feel? Is this a feeling or is this a belief? Like, what is this? So I need to know, B, let's talk about how you're feeling right now. Question 6. A nurse has finished teaching a client about the proper use of an inhaler. Which of the following best indicates the client's understanding of the teaching? The client exhales deeply before depressing the inhaler. So depressing means pushing the canister down. So they exhale and then press it, and you inhale, you press it and inhale deeply. Okay, so they exhale before depressing the inhaler. That's what they should do. The client states, I will shake the inhaler well before each use. Well, that's true. They should do that. The client states, I should use my inhaler only when I feel short of breath. No, that's not true. They should use it routinely. It doesn't say what kind of an inhaler it is. Since they don't say it's a rescue inhaler, I'm going to assume that they should use it as ordered. So I don't know how it's ordered, so I'm going to assume it's ordered daily or so. So I'm not going to choose C. D, the client exhales slowly after using the inhaler. Okay, so exhaling slowly after using the inhaler, that doesn't make a lot of sense. I mean, you have to hold your breath for like 10 seconds. So I don't want them to just exhale slowly after using the inhaler. So the correct answers are either A or B. They exhale before depressing the inhaler, or they say, I'll shake the inhaler well before each use. So here's what I want to teach you. I want to teach you that demonstrating correct use is better than verbalizing correct use. If it only had B, if A wasn't there, because remember, the right answer is the right answer because of the other answers. So if A was not there, I would pick B. But because A is there and you have the option to pick one that shows demonstrating correct behavior, that's better than verbalizing, because verbalizing says, yes, they know what you taught them, but that doesn't mean they can do it. Okay. And so I'd rather see them do it to indicate their understanding than just have them verbalize what I taught them.
Hello, Klimek Review family. As you probably know, this YouTube channel is part of a bigger Klimek Review organization, and we sell NCLEX reviews online on demand, as well as do live in-person reviews. We also do tutoring, and you can learn more about that at klimekreviews.com, but we also do streaming. And so I just want to talk with you just quickly about the streaming that we offer. If you go to courses.klimekreviews.com /pages/Klimek-streaming, and I will put this in the description, you can find out more about our streaming. You can start your free trial, or you can go ahead and join it for $19. And all videos are included in our 3-day trial. So what this is this is actually, you get an introduction to the Klimek Review itself, but you actually get all of our YouTube videos with no commercials. So if you go over here, you can actually pick me. You can say, oh, I want all of Dr. Sharon's videos, and you can see that all of the videos that are on YouTube are also here. So you can access all these things. So if you're like, I'm not a big fan of YouTube, or I really want everything with no commercials, then you can go ahead and sign up for our streaming. And so if you sign in, I'm signed in here. So here we go. All right. So that takes me to Klimek streaming, and then I can scroll through and watch the videos. So if I go back to my dashboard, this is actually where I can then access. I can also do tutoring, May tutoring. I can do the on-demand course as well. So this is sort of our dashboard provides you with anything you pay for that you get there. Okay. So, and don't tell anyone, shh, this is a big secret. Shh, don't tell anybody. But I may sometimes put videos up on streaming that I don't put on YouTube. Okay. So that's a big secret though. Don't tell anybody. So I hope you have a great rest of your day. Thanks for being a part of our family.
7, a nurse is teaching a client how to care for a surgical wound at home. Which statement by the client indicates an understanding of the teaching? So they're all statements this time. The last time it said which of the following best indicates the client's understanding. So here we have both behaviors and statements, but in 7 we have only statements. So we get to pick a statement. We don't have to look for a behavior here. So which statement by the client indicates an understanding of the teaching? I should change the dressing only if it becomes saturated. What we're doing here really is we're really testing whether you know anything about post-op care, right? Surgical wound care. So do we only change dressings? Well, let me read all the answers first. I should change the dressing only if it becomes saturated. I will clean the wound with hydrogen peroxide daily. I need to wash my hands before and after dressing changes. I should keep the wound covered at all times to prevent infection. So what do you know about care for surgical wounds after surgery? Do we have to keep them covered? We don't have to keep them covered. There's benefits to keeping them covered. It keeps them less accessible to germs and other things that may be flying around in the environment. D, I should keep the wound covered at all times to prevent infection. It's really not required. It's possible, but it's not required. So I'm going to cross off D. Now, I need to wash my hands before and after dressing changes. That's absolutely true. We do know you have to wash your hands before and after dressing changes. And remember, at home, people don't have to wear sterile gloves unless they tell you specifically it's a sterile procedure. And very, very few things at home are sterile procedures. Even dressing changes are not sterile procedures at home. And the client really just has to wash their hands unless they want to wear gloves. They can wear gloves if they want to, but they don't have to. So C is absolutely true. Clean with hydrogen peroxide. So I hope you all know that hydrogen peroxide should always be mixed with something, usually with sterile water or some saline. It can be mixed with either one of those things, but you should never use 100% peroxide to clean a wound. And I should change the dressing only if it becomes saturated. You should change the wound when it becomes saturated, but you shouldn't only change it when it becomes saturated, because if it doesn't ever become saturated, are you going to leave it on there for like 5 weeks? No. So you really need to, you're going to change it at least every day, sometimes twice a day. It certainly should be changed more often than just if it gets saturated. So the one we know is true is C. Okay, we know for sure that C is true. So if you know one is true and you're not sure about the other answers, I say this in every video, y'all, you got to be getting tired of hearing me saying it. Pick the answer you know is true, not the one you're not sure about. And I know you all know you're supposed to wash your hands before and after dressing changes. Okay, well, I hope that was helpful to you. So we talked about teaching learning principles. Really, it was only the last one that required you to know content related to that. So I tried to focus just on the principles of teaching and learning, but you need to be prepared for a lot of teaching learning questions on the NCLEX. And let me say this, because teaching is at the top of our skill set, of all the skills we do as nurses, which is teaching, dressing changes, charting, assessing, other skills, passing meds. These are all skills, right? These are all things that we do. And it's at the top of that hierarchy of skills that we do. Then first of all, we never delegate it to an LPN, and we never defer it. So if it gives you the option to defer it to the physician, it's not that the physician can't do the teaching, but the National Council of State Boards of Nursing wants to know that you will do the teaching because it is at the top of our nursing license. So I recommend you never defer teaching to someone other than yourself, unless you're sitting for the LVN exam. If you're sitting for the LVN exam, you can reinforce teaching, but you can't do the original teaching. Okay, so I hope this was helpful to you, and have a great rest of your day. Take care. Good luck on your NCLEX.